Welcome to Health Planning, an executive discussion series from Abacus Insights focusing on the issues and opportunities facing payers today in this ever-changing healthcare environment. My name is Minal Patel. It's my distinct pleasure to welcome Dr. Sachin Jain, who currently serves as CEO of the SCAN Group. The SCAN Group focuses on elderly adults and innovation, as well as operates the SCAN Health Plan across 5 states in the United States. Sachin is a pioneer and a luminary in healthcare, having had a variety of roles, not only being a clinician and physician, but serving in the public sector, as well as multiple roles in the private sector. He's been a stalwart advocate for clinical quality across the elderly population since most of his career. Sachin, welcome.
Thanks so much, Minal. Great to be here with you.
Sachin, SCAN's an incredible success story. As a not-for-profit Medicare Advantage plan, you were ranked number 1 in California at J.D. Power for customer success and customer experience. Tell me, how did you do that and the specific pillars of your success?
It's been a part of SCAN's culture since it was founded over 47 years ago in Long Beach, California, by a group of people we affectionately call the 12 Angry Seniors. These were a group of community activists who believed that the status quo of aging in their community was broken. And they came together as the Senior Care Action Network to try to address issues in aging and try to improve the quality of life for people in their community. And over the last several years, we've expanded to Arizona, Nevada, Texas, and New Mexico with a health plan that partners innovatively with provider groups to try to improve the quality of care and improve the quality of life for the people that we serve.
You're a not-for-profit Medicare Advantage plan, and I know you've served in for-profit plans in the past. Can you tell me what challenges or opportunities that status brings you, particularly as you go from being a regional plan now to a national one?
I really think we're in a David versus Goliath moment in healthcare, where even though we're a $5 billion entity, in any other industry we'd be highly material. We're the small fish in a very big pond of players whose revenues are in the 150, 180 billion dollar range. So I think we have to think differently and be creative in order to compete and really lead in this environment. And so a lot of what we drive towards is differentiation, and a lot of what we do is lean into our not-for-profit status to try to think longer term, to be able to deliver in ways that I think that larger national for-profit companies can't.
Can you talk about where healthcare data is most pivotal and instrumental to your programs and success?
I think that there's been largely a failure in the healthcare industry to use the growing volumes of data that really came out of the HITECH Act and the digitization of electronic health records to actually subsegment populations and treat them differently. It's one of the reasons I think companies like yours, Minal, are as important as they are, is you're actually facilitating the use of data to improve clinical quality and improve care.
And do you think the quality of healthcare data is where it needs to be today?
It is absolutely not where it needs to be today. I think that's where a lot of the opportunity really lies. And frankly, it's one of my greatest regrets. I was part of the team that David Blumenthal led to implement the HITECH Act between 2009 and 2011. And what I would say is that there were opportunities, that some of us talk about to have done that a little bit better. But if I had to go back and redo the implementation of the HITECH Act, I might have focused a little bit less on some of the advanced uses of data and focused a little bit more on, animating the data, making it more interoperable, making that a requirement of the federal subsidies that came out of the 2009 Recovery Act, and fundamentally focused more on flow of data up front than we did, through the meaningful use framework.
Why do you think healthcare executives today, particularly in the realm where artificial intelligence, large language models are getting so much attention, that they're not focused on the fundamentals of data? That still seems to be a gap.
I think it has a lot to do with the fact that a lot of people who came up through this industry don't understand it and don't want to raise their hand and say, I don't understand it at the level that I probably should. In fact, in large part because it's been a very fast moving field. I actually think as an industry, we need to take a big pause and say, what's just happened, right? This is a big seismic shift in our computing capabilities. And I think a lot of our work going forward is going to be leveraging this technology to try to achieve aims that were previously unthinkable.
Sachin, thank you again for your thoughts today. Your ability to go from real policy and macro strategy down to practical solutions for our healthcare system is always impressive, and today you have not disappointed. To our listeners, thank you for tuning in. I hope you'll join us for a future episode of Health Planning, where we get to talk about the opportunities and challenges facing payers today. My name is Minal Patel.